fine because I found her in good times.
All right.
Is that is so?
Yes, good
No
morning,
problem.
Uganda, and I am in good mood,
Okay.
really.
That's good. Dr. Monica Musenero Masanza, she wears three hats, I should say, because at least those that I know, she is the senior epidemiologist and she is the senior presidential advisor on epidemics, as well as a minister in charge of science, technology, and innovations. And we are here to understand much more information on as regards the journey we've made on the 42 days of the lockdown. But we know that many people, Doctor, they will tell you that they are tired of staying at home. After these 3 days that we are remaining with over the 42 days, should they just walk into their offices and resume work? Because we know that was one of the reasons as to why they went home, just to try and beat COVID-19. Should they just walk into their offices?
Thank you very much. First, I want to thank the Ugandans for really bearing this time. It's not easy. There is no one who pretends that this is easy, this is nice. No, this is a tough time. It's just because we are fighting a very dangerous enemy. So this work has not been easy, but here we are. We have achieved something together. We have managed to bring down the cases, which were just climbing astronomically. And soon we shall begin to see a steady decline in the deaths due to COVID. But this is an achievement that we have had together because we went into this. And now as we come to the end, towards the end of the 42 days announced by the President, first we needed to wait for guidance from His Excellency. And I'm sure he's preparing to guide the nation on what we are going to do. Just like you are instructed when you are going into those 42 days, he's also going to instruct us so that we safely know how to behave after the 42 days. So we expect the National Task Force to meet and discuss so as to guide His Excellency. Then His Excellency will address the nation and give guidance on how are we going to act after the end of the 42 days. What specific actions are we going to be taking after that?
I know the President has been singing praises to you, Dr. Musenero. Of course, you're a senior presidential advisor, you're senior in your field, but when you meet him, because I know today is Cabinet Day, and of course as the task force meets, there is some advice that will be pushing towards the President. What would you tell him based on what we've gone through so far?
The President has the prerogative to make the decisions for this nation just by virtue of his office. That is his mandate. So it's not only me, but there are so many advisors. But basically, I'll tell him, we can see the curve has come down. So the measures that we put in place, which he took out and told the nation, they have borne results. Then I'll give him other technical advice, which I can't divulge here, and then he will make his decisions based on not just what I tell him, but also others, because you see, epidemic control is not just about the disease. There is economy, there is society, there are so many things which he puts into consideration before he can make those decisions.
But majority of Ugandans who are watching us right now on Morning at NTV, they will tell you that yes, one of the conditions of the lockdown was that we have to at least vaccinate many people. But when you see the numbers now, they are really worried, make one worried and think that maybe the journey is still far away from being completed.
Yeah, this is a frustration to all of us. It has been very frustrating for us not to be able to access vaccines at the speed at which we thought it would. Of course, the lockdown was in itself meant to push down numbers. There is absolutely no way we could continue with the way we were going. So many deaths every day. Hospitals were full. We don't have oxygen. So the lockdown was to push down those numbers so that we can manage within the means that we have, but also buy a bit of time to build up, to scale up the oxygen production, the vaccination. But vaccine access is still slow. The Ministry of Health is really working very hard And as you see from time to time, they're announcing, we have got this vaccine, we are hoping to get this vaccine, and they will keep driving that up. And we hope that before the third wave, which we expect if we don't vaccinate, and even if we vaccinate, we expect the third wave to come. So before the third wave comes, we'll still have to have a lot of our the same interventions that we have had. We'll have to make sure that we are not gathering, we don't have super spreader events. I hope that our colleagues and our friends who were really involved in things which drove up some, like people hiding in the bars and infecting each other and taking the disease back to the office and infecting their colleagues, infecting their children. I hope that we have learned this. I hope that people who are like in public transport, who threw away the masks and threw away the standards, I hope that we have learned through this that when they say now open up with SOPs, we understand. It's not just a government thing. It's not a police thing. It's about all of us. It's about our businesses. It's about our homes, our families, our livelihoods, and our families being alive.
But when you talk about this third wave, you know, remember when during the first lockdown or the first wave, many people didn't take it serious until the second one, when you saw many people dying, and then people woke up then. Just want us to be exact, when should we expect the third wave, and of course, what should we even do for now to prepare for this, and how worse will that be, or even will it even be worse than the second one? Just bring us to speed about this third wave.
Now, the drivers of a particular upsurge in cases depend on human factors. How are we interacting? We also depend on weather. What is the weather like? We also depend on the virus. Is the virus there? How far has it penetrated? Because right now we are going to have some people infected in almost every place. So is it the same variant? Is it fast spreading? Which people is it infecting? Of course, we know that many new variants are coming in. This other variant which has been driving, the Delta, is now penetrating our communities. So in terms of weather, we expect rains to come back. So when the rains come back, the conditions become you remember the time of the last year's peak. So around that time, as we go into October, November, we will expect cases to start rising again.
We should be worried.
Yes, we should be worried.
And do something.
Yes, and do something. The issue is that when people listen to these things, some people just say, they dismiss. But if we are cognizant, if we are aware, then we will be able to take some precautions which will stop that rise.
But as government, for you, are you ready? What have you done? What's the thinking now as we prepare for the third wave?
One, we are trying to make sure that the healthcare services are boosted up, oxygen is boosted up, facilities for looking after cases are boosted. The second one is pushing for vaccination. Continuously, whatever vaccine we get, whichever doses we get, we'll continue vaccinating the people. And then thirdly, we'll continue having the mitigation measures. We'll continue having these measures which slow down the virus. So we'll continue having those. I am really praying that if we can all get to know and listen and just observe those few events that will push down and everybody takes responsibility, then we will be able to manage without having another lockdown.
Let's also talk about this period that we are still in of lockdown and also going ahead. Many institutions like education institutions are planning to go online. This directly falls into your line or your docket. When we see many institutions not even up to date with tech savvy. Internet speed is still low. Many areas across the country don't even have access to internet. What should be the thinking now? What should they be doing? Because things no longer the ordinary.
Now we had a situation, what we call the normal, that we lived by. Apparently, that normal had some gaps, but because there was nothing to expose those gaps, we didn't know. So it's now clear that over-congregating people in one place drives disease. And even when we vaccinate, it's going to take a while. The next 3 years, we shall be in the COVID. So what I would advise is for all of us to look forward. You know, there is a time for you to live without a road in a particular place. But there is a time in which you must have that road. And so there are places which didn't have internet. This is the time for every part in Uganda to have internet. This is the time because now education is going online. And I think it will be really sad if we don't take advantage of this time and we just want to go back to where we were before. We want to go back to those congested boarding schools.
Differently now.
No, we have to adopt the new normal. The way COVID is bad, but it has come to push us.
Okay. Just in 30 seconds, your last word to the Ugandans as we wait for the next presidential address.
The Ugandans, we have done well. I encourage you to stay. Please don't start doing things which are going to make you get infected in these few days. Just stay put. It's not easy, but we have made it this far. We will make it. So let's look forward to what the president is going to tell us.
Thank you so much, Dr. Monica Musenero Masanza. She is the Senior Presidential Advisor on Epidemics. She's a Senior Epidemiologist and, of course, a Minister of Science, Technology and Innovations. I should tell you, Doctor, that I appreciate and love your Afro style. That is the trademark for you since the days of Ebola. That's the time I first saw you. I've really liked it and I continue loving it.
Thank you very much. I hope I can inspire some young ladies and what we are really beautiful as Africans.
Thank you so much. Thank you so much, Doctor. And this is Stephen Mbide Mfefe Swechbuga taking you back to studio for Romeo Busiku. And thank you so much for being a part of Morning at NTV.
Thank you very much, my brother, for that update.